we've completed our examination, so we're going to go to case management. And earlier we entered in client goals and case notes. So we're going to jump down to symptoms now. Now we might want to put some of these symptoms in context. So let's see if I had an issue. Let's say I have some digestive issues. This is common among clients. If they're a little gassy, we can search in on symptoms and add them as we go. Maybe there's even some gastrointestinal bleeding and IBS, right? Irritable bowel syndrome. So we can search on symptoms and add them. And then we can, let's see, I'll put thin skin. I tend to have thin skin too, right? So we can, now we're adding all these symptoms at the top in the search box. And we can also begin to assess these symptoms as well. Dry skin can be dryness in rusa or the blood plasma or lymph. So I can add that as a syndrome. If the client has multiple signs of dryness in the blood plasma, they probably have a syndrome of it. Now, irritable bowel syndrome could have its own symptoms. I would call that tense. Excuse me, tense in. We could say tense in mumsa, right? Or let's see if we can. Um, let's see, in the food channels and digestion. How about that? Tense in digestion for IBS. And we also had entered in gastrointestinal bleeding. So for gastrointestinal bleeding, we might call that sharp in digestion. All right. So we've entered in some of these symptoms. And we've also added the syndromes, the patterns of imbalance. Now, naturally, in a consultation, we're also going to ask lots of questions, right? Gastrointestinal bleeding, I mean, the first question I'm going to ask is, how often are they bleeding? And so I can submit this question, and I can do this as my consultation prep, by the way, as well. Typically, that's when I do it, is in the, and how much bleeding, right? So how often and how much when the client bleeds. If we have some of these other symptoms here that were mentioned, gassy and irregular digestion, how often, when, and what causes gas? Maybe they already know that there's some dietary things that are causing gas for them. So I want to be able to enter in questions, and I'll enter in questions for most of the symptoms that the client is having. Thin hair could also be a sign of just general dryness. I mean, it's more dryness in the bones, but I could put it as a sign of dryness in rusa as well. So I'll stick it there. Notice, by the way, we can enter in some notes too around muscles or posture if we feel like we need to put in a bit more information about it. So this little circle here means to enter in notes. Okay, good. So this is how we enter in information about the symptom. We could also, while talking to the client, get some history information. So we see there's a notes section. Client had a more regular stretching practice in past years. Since, however, the feet are turning outwards. Recommended some exercises to strengthen inner thigh. So we can put any kind of notes that would be useful for us there. And you see here we have some other fields here. What caused it originally, about the onset, how was it diagnosed, all important information about symptoms.